Hey, welcome back. Well, today we're continuing our Care in Canada series, diving into the state of this country's healthcare system. And today we want to talk about access to care with two people who have deep personal and professional expertise.
Well, Christine Tizzard is a friend of the show. You will recognize her, who recently went through a terrible ordeal when her health took a turn for the worse. Sara Allin is an associate professor of health policy at the University of Toronto. Christine and Sara, thank you both for being here today. Christine, we will begin with the story because you were actually first diagnosed with a brain tumor at the age of 10. And you've been working closely with your medical team over this time to kind of keep an eye on it and make sure that it was okay. But in the last 10 years or so, your tumor started showing signs that it was growing. But you were told over and over again, it's not cancer, it's not cancer. At what point did you lose faith, though, in the Canadian healthcare system? What happened?
So, about 4 years ago, I just started to get all of these weird symptoms. So I would hear weird noises in my ear. My jaw would start moving involuntarily. I got debilitating headaches that would, I'd wind up in the emergency room. I couldn't get the pain under control. But because I had been radiated so much, had 2 bouts of radiation over the course of my life, they kept on telling me the tumor's stable. I think it's just all the effects of all the radiation you have. And then I got really sick. And a recent MRI came back and it showed that my tumor had grown quite substantially. It had grown over the years and it was missed. They missed
This was a brain tumor?
Yeah.
Okay.
So I got sent to a neurosurgeon. They did a biopsy, and that's when the biopsy came back and it showed that I had brain cancer. So I had something called a chondrosarcoma, which is actually a bone cancer. So you don't usually see it in the brain, but because it was cancer now, I had to have brain surgery. And that's when it kind of all went downhill after that.
Okay.
Yeah.
Well, Sara, I want to ask you, when you hear stories like this about inefficiencies and things being missed, what does it say to you about the state of our healthcare system?
Yeah, I mean, Canada spends among the top 10 countries in the world on healthcare, and so we expect a lot, but we consistently see harms coming to patients and shortcomings in the system, and we know we have problems, and so, governments successively try to reform and change the system, but these changes are always incremental. It's things like revising the way we pay docs sort of on the margin. It's about incentivizing providers to work together in teams, or trying to roll out an electronic medical record unsuccessfully. But all of these are really marginal, and there's never been a major shakeup or major reform to the health system, and that's perhaps what we need.
So, Christine, getting back to your story, you were then told that you needed life-saving brain surgery, and you decided to actually get that care in the United States. So first of all, why did you make that decision, and what did that entail going down there?
Well, it wasn't an easy decision to make, by all means. I worked very closely with the Canadian team here trying to figure out what to do. The only course of action was something called an endonasal endoscopic surgery. So it's where they go in and up through your nose and in through the back. Anyways, it's gross. And they kind of haul everything out that way. They could only give me a guarantee of partially debulking the tumor, and they weren't very confident. So I started looking elsewhere and seeing what else was available, and I found a surgeon in Pittsburgh that offered me a 95% chance of removal. So I had the choice of having the surgery here, but probably having it multiple times because they could only remove part of it, and then whatever's left behind would continue to grow. And because I've been radiated so much, and these type of tumors don't do well with radiation or chemo, getting rid of it was the only way to move forward. So,
and to confirm, what did your health care team here tell you about going to the States?
They strongly recommended that if I could find someone that could do the surgery that could offer a better outcome, that they would support me in that.
Interesting,
sure.
Interesting.
Yeah.
Well, Sara, internationally, the Canadian healthcare system is idealized, but we're hearing more and more stories like this about people going abroad for treatment. So what's going on here? Is it that we don't have enough talent, not enough facilities, not enough surgeons? Can you explain that?
Well, what we have in Canada is really limited capacity. So hospitals are overcrowded. We have, all the healthcare workers are, working at their maximum, facing burnout and stress as a result. And we don't have any spare capacity for innovation and for experimentation. And this is a decision we've made. With a single payer system, we have a budget. The United States, by contrast, has unlimited capacity. They spend twice what most countries spend in the world. They're an outlier internationally. But they also have 30+ million people uninsured. And that's going to increase if this new government has their way. So it's this kind of system that you want, and there's trade-offs.
So let's now talk about cost, because I imagine all of us are thinking, well, if you had to go down to the States, or you chose to go down there, Christine, that's a user pay system. You pay for care. So you ended up paying $133,000.
Wow.
For your surgery.
Yeah, and if I was a U.S. citizen, I probably would have had to pay over $500,000.
Wow. So you've actually gone back to the Ontario system because you've been trying to get that money refunded to you unsuccessfully. I know you're still fighting to get that money back to you. So what has this now taught you as you're in this fight post-surgery? What has this taught you about the Canadian healthcare system?
Well, it's broken. There's a huge void that people get lost in, and I just happen to be one of those people. I have a very unusual circumstance, so it's not black and white as per what you see on when you're Googling or on a web page or when you're filling out forms, right? You kind of get lost in this murky system. But I think for me, the worst is the wait times. Waiting to get care. My ENT surgeon here in Canada, there's a 15 to 18 month wait to get in to see him. I don't know if you noticed, but I have something really wrong with my eye. I see double all the time, and my eye is paralyzed. And it has been a nightmare trying to get an eye surgeon here in Canada to even see me, let alone try to get the help that I need. So it's the wait that, for me, is the biggest problem.
And Sara, when you hear this and you hear these details and this story, what do you think is the larger issue at play here?
Well, wait times are a major problem in Canada. And interestingly, wait lists are managed individually between providers and patients. So specialists manage their own wait lists. But things could be different. And the wait list could be managed centrally. And patients can have access to whoever has the shortest wait. And that may mean they have to travel to a different city or a different part of the country. And that's pretty common for people who live outside of major urban centers. They're used to having to travel from the north and from rural and remote parts of the country to get any kind of specialty care. So we could, make some progress there, but it would require some pretty big changes.
Christine, it's been 9 months since you had your surgery, so I'm curious, and I'm sure a lot of people are curious. How are you doing?
It was not an easy surgery to recover from, and by any means, it was long and pretty brutal. I was extremely lucky. It looks like they've gotten all the tumor out. I haven't gotten a clean bill of health yet, but I mean, what they did inside my head was nothing short of a miracle. I'm left with residual nerve damage because of how big the tumor had grown. But for me, the biggest thing is the pain and the fact that I am pain-free right now. Like, I can't remember the last time I took an Advil. It's crazy.
It is so good to hear that.
Yeah.
And Sara, just quickly, what do you see as the most urgent priority to fix this mess?
There's so many messes to fix, but what I see is a huge burden placed on patients to navigate the system, to try and figure out where to go and where to find information. Things could be different. We could have a system that prioritizes that every person has access to a family physician or primary care provider who can provide that navigation support information, but this needs to be available and accessible to people, and we don't have that here. But that could address some of these major problems that people face daily.
Yeah. Thank you both. Thank you, Sara, for your expertise. Christine, great to see you back in this studio. I know we'll see you again soon, back to food, and we're so happy you're doing well today.
Thank you.
Thank you. Thank you.
closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.